comfortable in this thing. Hands up the top, sitting on the side. I hope the dentist is a little bit more comfortable than this. And his implants, so it's definitely going to hurt, so he said. But I'm sure he'll be as gentle as he can. Alright. Not looking forward to it, but hey, it's got to be done, right? Earlier on today, I had 2 dental fillings, and I wanted to capture that experience for our viewers that, you know, might be thinking about coming here and getting, you know, dental work done, right? So I walked out of the practice, started the camera, and I soon learned that I'm not a pretty sight when half my mouth is numbed up. Now, some of you might crack some jokes and say I'm not a pretty sight anyway, but hey, it gets worse, right? So half numbed up, not good. So I thought, you know what, I'll let the anaesthetic wear off and I'll talk about it later. So here I am now talking about it. So I'm not quite sure what framework to use when you're reporting on these things, but I'll just talk about what was important for me. First of all, pain management. I never felt anything, right? He used a number of different pain management strategies to ensure that, you know, I went through the process without feeling anything. So of course there was anaesthetic. I never even felt the anaesthetic being applied, so that was wonderful. The second thing was hygiene. You know, the place is pristine. It looks really good. You know, he's wearing masks. You know, dental technicians wearing gloves, masks, all that type of stuff. You wouldn't expect anything less from a professional practice, so you can see all that. The next thing was the colour matching of the filling to my existing tooth. Now, I've seen fillings in people where you can actually see the line where the colour changes. Now, he brought the mirror right down close to my mouth and I could see very close up, and I could still see now where that filling went in, but you can't see it, right? So, perfect colour matching and perfect smoothing or whatever they call it, so I don't actually feel that there is any lumps or bumps or anything like that, so it's a really great job. So from that point of view, a great positive experience, and you know, I'm not worried about anything. I'm happy to go back and have the rest of my dental implant treatment there. He's making a really positive experience on me, and yeah, I hope this has been valuable to you. Let's move on to the next step, eh? Well, I've just come out of the dental surgery and I'm quite happy. The second stage of my implant surgery has just been completed. Dr. Ray has taken impressions of my gums and my teeth so that he can now mould up the crown that's now going to go into the 2 places where I've had the implants. I've got to say, at this stage, I'm feeling pretty good. He's explained everything to me as he was going. There's been no surprises. He's had to make certain adjustments as he goes along for my particular mouth, which does raise some complications. For my particular mouth, it does raise some complications because not everybody is the same, as I understand, and the dentist has to be able to make adjustments for people. So he's done that without any problem at all, and helping me understand what adjustments were made and why they were made, which I think was really good. As far as the overall procedure goes, I'm feeling very confident in my decision to have my dental implants done here. Contrary to a lot of feeling that may be back home from people that say, oh, you shouldn't go overseas to get, you know, medical treatment, that type of thing. What I have now discovered by doing this here is that we can save a shitload of money and get top quality care. So I felt really good about working with this dentist so far, and I'm really looking forward to getting my crowns put on the tops of my back teeth, which are the next phase. So I'm coming back in a week or so to have that done, and I'll be able to show you what it looks like then. Well, here I am back again at my dentist. I've just left. Second implant is in, and I feel fabulous. Despite the appearance because of the anaesthetic, it's been very, very good. And in terms of pain, yeah, it was pretty painless. Yeah, you always have worries about pain, going to the dentist and that type of thing. Typically, you know, people reflect on the experiences they've had in the past, you know, and I'm not a young fella, so, you know, I've had my share of dental surgery and things like that when I was a kid, and, you know, it was pretty tough back in those days. They had anaesthetic, but yeah, it always hurt. But this was very, very good, and the dentist here, Dr. Ray, he used a lot of imported stuff, right, that's not available in the Philippines. So I took advantage of that, obviously. Not it wasn't my call, it was his call, and he used some really cool techniques and some cool materials that really helped the whole pain management process. So in summary, I'm feeling really great. I've had one implant in for about 2 weeks now, and I'm chewing on the right hand side, and I never thought it would be this good. You know, for a person that hasn't had, you know, basically back teeth since I was a child, I really didn't know what I was missing, and I had that one put in, and all of a sudden my whole consumption of food has changed, right? And I just feel like I'm really enjoying food better, and I certainly know my stomach's going to appreciate the fact that I don't just swallow anymore, right? So this one, have to wait about 3 days for things to settle down until I can eat solids again, but happy to eat soft foods and everything. So I'm not going to hang around in town. I'm going to go out and see some sights and do some other stuff. Dr. Ray's always only a message away if I need anything. Yeah, really, really comfortable and really happy to have used his services over these few months, actually, that we've spent together on different occasions. What would I say about going overseas and getting dental implants? I think people say it's a risk, right? And I would agree, it is a risk, until you find someone you can trust. Now, I haven't been paid for this review, and I'm not incentivized in any way, shape or form. This is totally my opinion. I just felt like the research I'd put in to find the right dental surgeon, dentist, whatever you want to call him, really paid off in the end. You know, I messaged, I emailed, I talked with dentists from a number of different places, Thailand, here in the Philippines, Manila. I found this guy in Olongapo, Pacific Bay area, and one of the things that sort of hit it for me was I also seen recommendations from other expats that had used him that are living in the area. So he's kind of the expat dentist, right? And when you have that kind of recommendation, it makes you feel a lot more comfortable. Then, of course, it was the first meeting and the way we connected, and the fact that, you know, he briefed me on everything I needed to know, the time period that I needed to wait in between the positioning of the first part of the implant process and then the crowns later. You know, I had all sorts of experiences with different dentists, some saying to me, you know, we can do it within 2 weeks for you. Others saying, you know, you have to wait longer periods of time. Others saying we need full blood tests and all of this other mumbo jumbo. Now, I'd already had x-rays and stuff done back in my own country, and I'd been quoted a pretty hefty price. Well, it's not cheap getting dental implants in the West, right? And what I had done here was half the price of what I paid in the West. Now, you might say to yourself, yeah, but you had to pay for flights and all that kind of stuff. Well, yeah, I did, but I was going on holidays anyway, right? So this enabled me to have a paid holiday through saving on the costs that I would normally spend on a dental implant back home. So all in all, I was able to see a significant amount of the Philippines, really enjoy my stay here, meet some wonderful people, and get the dental implants that I needed for significantly lower costs, and by the way, using high quality materials that I would expect back home. So all in all, would I recommend it? The answer is yes, 100% recommended, provided you can find a dentist that comes with a solid recommendation from expats or people from your own country, great track record, and it's someone that you can connect with and trust, right? So I think I found that in Dr. A at Barreto, and I would thoroughly recommend him to anybody who's interested in any form of, dental implant type surgery. So that's about it for me. I think I covered off the whole dental implant thing. The only other thing I would add is that my particular situation was somewhat complicated because the shape of my existing teeth had changed significantly since I was younger, right? So as you lose back teeth, your teeth start to, your existing teeth start to reshape in your mouth, and it causes some deformation, right? So he had to tailor make the solution to suit my mouth, right? Which was marvelous, right? It's just watching a specialist in action doing that kind of stuff, and being a part of that process along the way is pretty cool, right? I think dentistry has come such a long way, and watching professionals work, or GP going fast, watching professionals work in that type of complexity really is amazing. I know that going through the process of assessing your dental needs and your dentist, and where you're going to get the work done and that type of thing can be quite complex and complicated, and there are a lot of people on the sidelines saying don't do this, don't do that, do this, don't do that. Some of them have already had dental work, some haven't and have no idea. People are informed by media horror stories, but you don't usually hear about the stories where everything goes well, and I'm sure that there is more that goes well than goes pear-shaped. That being said, I think you can do a lot to help yourself ensure that you get a quality outcome by doing the research, such as I did, speaking to people, and you're looking for practitioners, really professional practitioners that have a great track record, and you don't rush things, right? There's some minimum standards that should be adhered to as people perform various type of procedures, whether it's dental implants, hair implants, whatever it is, right? And you can quite easily find those standards, and you can set yourself up a checklist, and anybody that doesn't meet the standards is immediately off the checklist, whilst those that tend to sound like they're meeting minimum standards should be in your consideration set. So all in all, I hope you found this video useful. If you did, please like and subscribe. Thanks for watching, and good luck with your search for dental implant surgeons. Thank you for watching, and have a great day.